In this video I'm going to talk about the complications after upper torsoplasty, also referred as the upper body lift. And this is surgery mainly for men. Well, it's surgery for men that have loose skin or very severe gynecomastia in their chest area. It can be a circumferential one, it can be an anterior one, it can be combined with liposuction, suction-assisted lipectomy. Now, the upper torsoplasty is a form of upper body lift that performed after massive or significant weight loss, commonly considered in men after bariatric surgery or long-term weight reductions. And in these days, the medication side of things do have a lot more prominence than in the past few years. It's designed to remove excess skin and residual fat from the male chest, lateral chest and upper back area and flanks. So and those areas are common areas that can have loose skin after weight loss and that persists even after some time. I usually recommend to wait 6 to 12 months after your weight loss to get to consider surgery, but certainly in some men they have had previous gynecomastia and it's got a lot worse because it combines the loose skin and gynecomastia after the weight loss. So they may come in and see me quite early. The operation can be done as a standalone procedure, or I can combine it with body contouring of other areas of the body. And that's a really important consideration when I see you initially in the consult, is what other areas do you have? Do you want other areas combined with the operation? How can we combine it safely? What's the biggest sort of operation we can do and still keep it quite safe? All surgery has complications. So any of the body contouring surgeries have very, very similar complications. They have wound-related stuff, they have deeper stuff, so I'll go through that, but certainly it's really, really important to know that you will have potential complications. The complication rate, the severe or the very serious complications, they probably range from about 1%. Less severe, like wound complications, are more common, and I usually tell everyone that you will get some sort of minor complication. That's almost guaranteed. It's either wound breakdown, stitch popping through, minor infection, that sort of thing. So expect that. That is usually something we treat in the first few weeks of your operation. Obviously, a complication is an unintended medical problem that occurs after surgery. And it's different from the expected problems that happen. So when you have a surgery, you will have pain, you will have bruising, you'll have some numbness in the area, you'll have pain on mobilizing. Those are all part of recovery. They're not really complications as such. But what are we talking about here is that purely the things that go wrong that we don't want to go wrong and we don't expect to go wrong. So, bleeding and hematoma. If we are doing a big area usually, even if you're doing the anterior circumferential, there's a big space, there's lots of blood vessels that need to be sealed. So you may start having a blood vessel start bleeding. And if it bleeds rapidly, you're going to be unstable and we have to take you back to operating theater urgently to open up the wound, to seal the bleeder, to tie it off. Obviously, there might be, if it bleeds a lot, you might consider blood products, and that can be quite a serious situation. That is a very, very rare situation. I would say it's probably something in the range of 0.1%. Hematoma accumulation of blood does happen a little bit more frequently, and that's why we have the drains to try to drain away some of that fluid. So if there's a small amount of blood coming through, that is kind of expected, and that doesn't usually create a problem with accumulating blood. Now, with the hematoma, if you get a hematoma that's stable or small, then we can usually treat that in the practice. It usually dissolves on its own. Sometimes it takes a few weeks, we can aspirate the hematoma. If it's a bigger one, then usually we do have to go back to the hospital and drain it. Seroma. Now, seroma, anytime we cut the body anywhere and create a space, we create a space for the body. The body wants to fill the space with fluid, and that's why you get fluid accumulation in those operated on areas. And that's why I use drains to drain away the fluid. Now, when the drains go, they sort of flatten the area and it heals together, and then the fluid can't accumulate again. However, if that space starts to accumulate again, then you may get what's called a seroma, or fluid collection. So, and to get rid of that seroma, I have to put a needle in and pull the fluid out of the seroma so that tissue flattens again and hopefully heals together. Generally, if you get a seroma after we pull out the drains, I need to do about 2 to 4 aspirations over about 2-week period to try to get rid of it. Most of the time it will go away by just doing conservative management in the office with the aspirations. It's very, very rare that we need to go back to the operating theatre to fix a seroma. Now, delayed wound healing or wound breakdown is a very, very common problem after any of the body contouring surgeries and also after this surgery. It's a little breakdown in the wound, and the wound opens up. You see a little bit of fluid, gunky tissues. There will be a little bit of discharge from that wound. Most of the time, what we need to do with that is just dress it and wait for it to heal up. If it's a small area, it tends to heal up within 2 to 3 weeks. If it's a bigger area, then it may need a 2-step approach. So usually we dress it in the office. Once it's been dressed and you come back for regular dressings, it heals up, and then you'll have the little granulation tissue, which are the blood vessels growing into the area. And once that happens, it tends to shrink down and heal up. Sometimes it doesn't. It takes a long time for a big area to heal up, and that's when we take you back to operating theatre, debride it, close it for you. But that's kind of something I will discuss with you as we go through your recovery and see which way you want to head, how long you want to wait, how much dressings you can tolerate, and again, most of those little areas do tend to heal up. Sometimes they do get infected, so we treat with antibiotics, but most of the time it's just a matter of waiting for it to heal up by what's called secondary intention. Now, wound infection. There's a whole range of different wound infections. Minor ones are fairly common, like minor little redness, but if it's more serious, it can have spreading redness. And if it's really serious, it can have systemic effects as well. So fevers, shivers, a big infection can affect you, the whole body. And if that happens, then usually we do have to take you back to hospital, not operating theatre generally, but hospital, and treat that with IV antibiotics until it settles down. Usually we do a wound swab and send that off to see what bacteria is causing the problem. And then hopefully we can treat that bacteria specifically with an antibiotic. Skin or flap necrosis. When we're lifting skin up, we are cutting blood supply to the skin. So it's possible that skin that doesn't get enough blood supply will die, and you end up with a black area. That black area is necrotic area. So I have to basically cut that area out, and then once that's cut out, it's an open area or like an open wound breakdown, and that is treated the same way with dressings, waiting, possibly restitching it in a couple of weeks' time. The nipple areola is another specific thing with this operation. We are grafting it on a higher position, and if it dies, then unfortunately you end up with a little scar where that nipple areola has sat. Usually it doesn't look too bad, but obviously it's not your usual areola, so it's not the same as if everything was fine. A lot of times it's a small little area or rim or part of it that dies rather than the whole thing, and that can sometimes be fine once it heals up. It just becomes a little bit of a thicker scar in that area. Now, I spoke about sensation changes. You will have sensation changes in your chest area where we've done the operation. So it'll be tingles, numbness, hypersensitivity, changes in sensation, and it'll be definitely changes in the nipple areola because we are cutting it off. So we're not preserving any of the nerves in that area. Does tend to take about 3 months to settle, 3 to 6 months. And once that happens, usually you get back to being a little bit more normal after that. Very rarely can you get chronic pain, shooting pains and nerve pains after an operation, and that's something that we can discuss at the, if it does happen. It's not very common. Scarring. Everyone will have scars. The scars are generally planned in the under the pectoralis major muscle. Sometimes they're thick, sometimes they're thin, sometimes they widen. It's difficult to predict how these scars are going to appear. There are some high tension areas in the lateral chest area that do tend to get a little bit wider. I tend to use silicone strips and other scar management. If it's a really thick scar, we get steroid injections, but certainly scar maturation also takes quite a long time, so it takes about 18 to 24 months for the scar to mature and fade and look a little bit less obvious. You will find that the first 6 months it's going to look really, really obvious because it's red, it's angry looking, and then after that it's going to be fading away hopefully for you. There can be contour irregularities and residual skin after the operation, which most of the time we don't have to really do much about. Sometimes there's a little bit of puckering that happens in the sides. Again, that tends to settle on its own, but sometimes we have to come back and fix that up for you. So that's all. That's mainly the local stuff that I've been talking about. Then you have the stuff that can happen with any operation. So clots in the leg, lung issues, pulmonary emboli, anesthetic issues. So with anesthetic issues, nausea and vomiting is probably one of the most common. Blood pressure issues after the surgery. Obviously, there is a small chance of dying from any operation, so that's something to keep in mind as well. You have pain and discomfort and all that stuff as part of any operation. So it's really important that you know about these all these potential complications. I will go through it in detail for each operation, and hopefully this has been useful. I'll see you in the next video.